everyone, and welcome to Stay in Medicine. I'm Dr. Janet Cruz. Tonight, I have the pleasure of sharing a conversation with Dr. Leon McCrea. So, Leon, for me, is what I embody and what I envision in a family medicine physician. He is an absolutely amazing mentor, educator, leader, and beloved by his patients. Before we jump in to the show, let me just list a few of his many accomplishments. So Leon started his journey at Brown University, followed by the University of Pittsburgh, where he earned his doctorate in medicine and master's in public health. He completed his residency at Cruz Keystone Family Medicine Residency Program, where they liked him so much, he stayed and subsequently became associate program director. In 2015, he caught the eye of Drexel University College of Medicine and was recruited to serve as the program director of the Family Medicine Residency Program and was appointed Associate Professor of Family Medicine. Leon is absolutely a builder and committed to making medicine better for everyone. As such, he has served in various committees and boards, including the Association of Family Medicine Residency Directors, which he is now part of a board of directors. He has also served on many panels, including panels surrounding diversity and health equity. In 2018, he was appointed Assistant Dean of Diversity, Equity, and Inclusion for Drexel University College of Medicine and was recently promoted to Senior Associate Dean. So Leon, welcome to the show.
Thank you so much, Janet. Great to be here.
And for me, it is an absolute pleasure to have this conversation and really to show the world, the individuals that are in medicine right now. So the one thing that I most admire about you, and I've always admired about you, is your relentless pursuit of creating a more diverse environment in medicine. And I've seen you do this real time. I think for most workforces, they want a diverse presence. We know there's evidence that having a diverse presence is really key to solving complex problems. And you have done this at Drexel and continue to do it. So tell us a little bit more about, your passion in this venture.
Um, Thanks so much. Definitely appreciate the words, and I'm a little bit humbled. It's always a little bit crazy when you hear people talk about you. Um, I'll start with this. When I think about why I'm doing medicine, I think it really starts with creating opportunities for people who look like me. And what does that mean? So it means people who either come from historically underrepresented groups. It means folks, who may have not otherwise had opportunities to get access. And it really is my passion, my responsibility to create avenues for them to become physicians. And it matters for a number of reasons. The most important of which is that these individuals are more likely to take care of underserved populations, right? We know that if there is a concordance between doctor and patient, health outcomes improve. So if I can increase the amount of individuals who are actually going to be high quality providers, then I feel like I've just made a little piece of contribution to this role and to this journey. So, that is really what's giving me my drive. It's what kind of gets me up every day. It gives me my juice and my energy. So, that's what I try to work to provide every day I go to work.
And it's funny, I don't know if you knew this about me, Leon, or not, but I was actually part of those programs, so when I was in high school, um, I didn't know I wanted to go into medicine. I
Mhm.
actually just told my guidance counselor, listen, I need to go to college and I need to go for free and I'll do whatever it takes. And that's how I actually ended up in this BSMD program, this combined bachelor's and medical degree program.
Sure.
And I remember doing these summer programs that were tailored for, minorities and that were interested in science. So one was sponsored by Exxon, and we built robots. And I had no idea, the world that was out there. I mean, for my family, you're a large family of, 5 children. Both my parents maybe reached the sixth grade,
Mm.
um, and it was just a different world that wasn't available for me until people invested and made
Right.
those opportunities available. And I mean, I will toot my own horn. I think I am an absolutely amazing physician. I
Of
will say
course you
it,
are.
but
Yes.
um, I I will echo what you say. You know, I think a lot of patients identify, they're more inclined to reveal things that they might not have revealed. I mean, I've had patients that come to see us in the office. Say, hey, Dr. Cruz, you listen,
Mhm.
you know, you get it, you get how hard it is when they're diabetic. And you know, at least for me, I'm Puerto Rican, right? We eat rice and beans every day. And for me asking them and saying, hey, listen, I know your diet, I know because I eat it, I love it,
Right.
but tweak it this way. You
Mhm.
know, this is what I do at home. You know, this is how I do Christmases in my family. And we're still culturally doing the things that
Mhm.
you love. So, I mean, for me, it hits some heartstrings because um, it required people like you know, to invest in, you know, a system that really provided these opportunities for me to be in medicine today.
So, Janet, I think you touched on a couple things. I think the first thing you mentioned when you talk about the pipeline and it's the planting of the dream.
Hmm.
Like sometimes you need someone to create the dream for you before you know what to dream about. So I
Yeah.
can remember when I was a kid, someone asked me like what I wanted to be when I grew up, and I didn't have an answer. And my mom was like, absolutely unacceptable. She was like, you got, yeah, tell them something. And so it was like doctor, lawyer, something, whatever the case may be. And I was good at math and science. And so actually from that moment, doctor was the thing. Like I didn't know all the steps, but someone just planted the seed.
Hmm.
And then it was summer programs. You know, in Pennsylvania, we have this thing called the Pennsylvania Government School for Sciences. And I went and I was hanging out with all these really bright students across the state, and we were exchanging ideas. That's where I actually learned about Brown University. I didn't even know Brown University existed until I was in 11th grade. My summer counselor, she like was there. She was in this medical program at Brown. And all of a sudden I was like, oh my gosh, I want to be like her. And so like I literally applied to like Brown, went on this trip, went up there, saw the campus, ended up having like this phenomenal experience. And so when I look at it, I think like, oh my gosh, like that's where it began. Like someone started to plant the dream.
Yeah.
And then what you do is you just have to flower it. You just have to nurture it. And if you nurture and flower it, eventually it grows and develops into something. And it is that ability to connect and to believe. And then that translates into ultimately patient care. So, you know, you mentioned the rice and beans and or Spanish rice or whatever else. Like, you know, my running joke with my patients are people always say, oh my gosh, Dr. McCrea, like you have this kind of like patient following. And I'm like, well, you know, I mean, I've been being a doctor for a little bit. And I enjoy taking care of my patients. But they also say, Dr. McCrea, they'll be waiting for you for like an hour or 2 hours. They don't complain. I don't get it. And what I say is that listen, I am unapologetic about the kind of doctor that I am.
Mhm.
Like, so I figured out really early what it was that were the things that were exciting to me about the doctor-patient relationship. And for me, that was the ability to sit down and actually have a conversation and know something about your life.
Yeah.
And so I deposit in my patient deposits back in me, right? I share a story about something that's going on in my life, and then they tell me three more stories.
Mhm.
And now that I understand what's happening with them, I can actually take care of them. And so the running joke with my patients are I tell them all, look, just come on in, bring your iPad, bring a book, just
Bring
get
some food.
comfortable. Yeah, whatever, right? Just be comfortable. And then they know once I'm in the room with them, they got my time.
Yep.
And it may go a little over. Sometimes it may be quicker. Sometimes they may go bring up an extra problem. But like once I'm in the room with them, I'm in the room with them.
Yeah.
And then that's just been the relationship. And so you know, I think that the other thing that happens with that is that, you know, what was really important as you kind of evolve as a doctor to increasingly become comfortable in your own skin
Mhm.
and have a realization about who you are and what are the gifts that you contribute. And then if you can actually embrace those gifts, I think you're actually able to share them and do greater things. One of the things I think we all suffer with, and they come up with fancy names for it now, imposter syndrome, this, that, and the third, whatever they want to call it these days, right? But it really is all around this concept of, am I focusing on the things that I do well, or am I always looking at the one or two things where I may not be so perfect?
Mhm.
And then instead of spending 80% of the time trying to fix that small piece of me that's not amazing, how about I lean into my awesomeness? Like, Janet, you are awesome and you are phenomenal. Like, lean into that awesomeness,
Mhm.
like
Yeah.
all the time.
Yeah.
Like, yes, is there like this, listen, I wish I could still have hair, right? I'm follicularly challenged. Like, that isn't my thing anymore. So you know what I've embraced? I've embraced, like, you know what? Not having to worry about my hair anymore is an awesome thing. Like, like I've just totally turned it on its head. And so those are the kind of things that I think that we need as physicians, as we kind of lean in to this new existence, is an understanding and an embracing of who are we, and are we comfortable in our own skin?
Yeah. No, it is interesting because we're both educators. We both have medical students that shadow us and see. And I know coming out some encounters where I share my personal stories with students, but also with patients. And I tell patients all the time, hey, what you're going through is hard. And tell me what's going on at home. Tell me
Mhm.
what's going on. Um, because I feel like we provide more than just actual medications.
Mhm.
It is funny that you mentioned about, your patients staying and really committing to stay and waiting for you. This was about a year ago now, but I have this couple that I absolutely love, and I know them I feel like on a personal level.
Mhm.
And during lunch, I used to run in Philly, you know, and one of them, saw me in a car, chased me down. Hey, Dr. Cruz, slow down. And he has, peripheral vascular disease. And, in Philly, someone, at least for me, I'm not used to an inner city, someone yelling my name, chasing down after me. I was like, okay, what's going on? So
were you
I
about
turned
were you about to
around.
pull out like your military techniques? Like, what's up, right?
It's so funny though, because, I slowed down, I turned around, and it's this patient that I've been following, and I was able to get him to stop smoking. And I mean, he is the success story. But, he ran down. I said, "You okay?" He goes, "Yeah, this is the most amount of exercise that I've done, and I did it for you, Dr. Cruz." And I said, "All right, listen, we're getting there. We're getting there." But I feel like once you make that connection to your patients, they'll do more.
Mhm.
They'll invest in themselves more.
Mhm.
And I think, or at least in my experience, especially if you have a physician that looks like them, that
Mhm.
identifies with them, they start believing in themselves more. At least that's been my experience.
No, absolutely. And Janet, I just think like the other thing is in that, we often think as doctors that we're not supposed to be selfish. But you know what selfish is for me? And I think it makes me enjoy my job is like, I like hanging out with my patients too. Like that feeds me. Like, no, in truth, if the interaction with the patient wasn't to some degree feeding me, then I should be doing something different. Like I should not
Mhm.
be completely drained from the entire patient experience.
Yeah.
Because then I need to change the dynamic in the patient experience so that some component of that is feeding my soul. And so,
Mhm.
like, if I'm getting something out of it, if I'm enjoying that interaction, if I feel comfortable enough to give a patient, you know, my cell phone number so they can text me if something actually is happening in their life
Mhm.
and know they're not going to abuse it, like that's that level. And that's like, no, I actually want you to be a little bit closer to me. I want you to be part of my life.
Mhm.
We are family doctors.
Yep.
Our genesis is being in the community. Our genesis is like, having a group of people for whom we are responsible. I took a trip to Cuba not
Mhm.
that long ago and had an opportunity to see what it was like to practice medicine there. And
Mhm.
so the family medicine doc is on the bus, riding into the practice, riding with everybody else,
Mhm.
like has an office in the community, literally not much bigger than like two of our exam rooms and like a closet for an office. And like everything is done in that space. And he's like, literally, it looks like a house. And people come and he goes and does deliveries in people's homes. Like it's the pure essence. Like like when I was there, it just felt so pure. It was
Mhm.
like this is like you're at one with your community. There wasn't this crazy hierarchy. There was just an
Or time
understanding.
constraints.
Oh, at all.
Time
No, it was
constraints.
totally, listen, and definitely not any EHR stuff, electronic health records,
Yeah.
right? But it just felt pure. And I think that sometimes we just need to remember,
Mhm.
like, what are you doing this for?
Yeah.
Who are you doing this for? And you can be doing it for a lot of reasons. It can be for financial security. It can be because it gives you a warm feeling in your belly. It can be because, there are people who are underserved and you feel like you need to manage those individuals. It could be because it scratches an intellectual itch, all of which are okay.
Mhm.
Like, you need to find the thing though that like pushes you in that direction.
Yeah. So I want to talk a little bit or focus in on your passion for bringing um, you know, these opportunities for individuals that never,
Mhm.
wouldn't otherwise have these opportunities into medicine. So one, as an individual that is part of an underrepresented population in medicine, what barriers have you faced? What sort of challenges have you faced with, this healthcare system? And then how did you break past them?
Um, it's a fantastic question. And so I always like to preface things by saying that I am blessed and I am privileged, right? I am blessed and I am privileged in that I've had an opportunity to have two parents who invested in me, who laid like incredible foundation. I was able to go to phenomenal universities, um, and ultimately take advantage of the education to make a fantastic career. It doesn't mean though that it's not wrought with missteps, most of which have to do with the fact that many of us are charting the journey on our own for the first time. How do you deal with failure if you've never failed before?
Hmm.
How do you understand about studying with others? How do you break into social circles that are different than anything you've ever had before? How do you start to have conversations about things that were never part of the conversations you had when you grew up?
Yeah.
How do you understand the power dynamic that is medicine, the hierarchy, those responsibilities? How do you deal with the isolation associated with when things don't go according to plan? Because it's great when everything's going perfect. I always call the journey to becoming a physician like a Facebook page, where everyone you interact with always shows you their best self. Like,
Yeah.
no one posts crap on Facebook, right? They're always smiling, they're always beaching. Like, no one puts on Facebook like themselves unmade up, didn't brush their teeth, haven't showered in 4 days, right? All you see is like their glam shots. Isn't life great? Oh, I
Unless
look
you have a
fabulous.
jokester like my husband that will post a picture of me and Alina
Well, that's because you guys
falling
are
out of
super,
sleep.
but you guys are super real. You're definitely the exception to the rule. But the same thing happens in medical school, right? Which
Yeah.
is that, people only present their best selves. So you think that when you're having a difficult time, everyone else must be going perfectly well because there's no
Hmm.
open communication. And then there's just all of the hidden curriculum
Yeah.
that is the path to becoming a physician, about understanding that like not every question is actually a good question. Like, oh,
Mm.
you mean I can't just ask that? Like, I'm actually not allowed to be 100% vulnerable in this space,
Mm.
right? Like, this person's supposed to be teaching me, but I need to still prove myself every time. Like, what does it mean? I used to have hair, right? I was not always follicularly challenged. I had dreads halfway down my back. Like, how do I discern when there are people who are either staff members or nurses or other clinicians who are saying, like, can I touch that?
Mhm.
Like, how do you do that? Like, is that stuck on? Or, like, what is a dread exactly?
Yeah.
How do you wash it?
No, and where's also the boundary between they're just curious or now they're being rude. Like, could we do that? You know? And
It
it's
is.
it is very interesting because for myself in medicine we had a small group of
Mhm,
Latino
mhm,
students, right? And a lot of the things culturally that we do to connect, like in my family, Christmas, you play dominoes,
okay.
there's these certain things that you do to connect. But we had a small group of friends that kind of shared similar culture.
Mhm,
When I stepped to the military, I was the only one.
The
So
lonely, you were the
the
lonely only.
lonely, yeah. I mean, at least from the officer end, on
No, but
enlisted end,
that's always the problem. See, Janet,
yes.
like, you know, there are, as you continue to redefine yourself
Hmm.
in terms of your position, you often find that there is increasing isolation because there are not often people in the same position.
Right.
You know, I always say to myself, if I was looking for an African American male in medicine
Hmm.
in significant leadership to be my mentor, I would be looking for a really long time.
Hmm.
And so one of the first things I had to learn when you talk about barriers and or things you learn to overcome is that you have to learn how to find mentorship, to find sponsorship, and to find advising in people who don't look like you.
Hmm.
Because there is initially oftentimes an intimidation around even having the openness or willingness to start having those conversations around, well, can I trust this person? If I'm vulnerable, what does it mean? Will
Yeah.
they understand what I'm talking about if I decide to be vulnerable? But then you understand, and this is if there's a key, if there's one thing I try to tell everybody today, it is you actually have to share with others what your dreams are.
Hmm.
Because if you don't tell them your dreams, then no one can help you.
Yeah.
Like if
Yeah.
I
And
need
if
to
if an
know,
opportunity comes up, they'll never know.
they will never
They'll
know.
never
I
know.
cannot tell you how many times I have people, especially people who look like us, who say things like, why was I passed over? And my first response is often, did anyone know you actually wanted the opportunity?
Hmm.
Oftentimes people will say things to me like, well, I've been here a long time. By now they should recognize my talent, all of which is
Yeah.
true.
Yeah.
And yet, and yet,
Hmm.
you still have to make it known what you want. There's this old joke about, you know, um, somebody lives in a neighborhood and they're running for an office, and you figure
Hmm.
like all your neighbors would vote for you, right? Because y'all in the neighborhood together, and then the guy loses the election, goes to his neighbor and says, like, how come you didn't vote for me? He says, well, you never came and asked me for your vote. Right? Like you need to tell people.
Yeah.
Like even though your neighbor knows you're running, you have to go and let someone know what it is that you're interested in.
Yeah.
So other things I think that are barriers that I think we have to overcome. Some of it is the imposter syndrome. It is that idea that I'm so focused on the things I'm not perfect at that I don't lean into my strengths.
Hmm.
There are things that we are amazing at. And we are so concerned about those other things that we just don't, as I'm leaning into the camera, just lean in a little bit.
Yeah. Yeah.
Like,
Well, we
go
don't
get it.
we don't realize it ourselves. At least,
No.
for me, very early in my career, there were things that I was so good at, and I was just so focused on what everyone else was doing. And I said, "Oh goodness, I don't know what, I don't know how to do this. I should know." I can't tell you how much in my first 2 years of being an attending, I was like, I should know how to do this. I should know how to,
Mhm.
instead of saying, I'm really good at this, and just running with that.
Yep.
Like for me now, you know me very well now. I'm good at operations. I'm good. And finally,
Good. Freaking amazing.
yeah, but I finally have gotten comfortable with just going with it, and I agree with you. And this is part of the conversations that I have with med students now that rotate, with us, residents that rotate with us, is really outlining like, listen, you're really good at this. Like,
Hmm.
have you thought about this? Have you thought
Hmm.
about, getting an MBA in addition to your
Yep.
MD? Have you thought about, because even for me, it took someone doing that for me to really push me to the next level.
Yeah, absolutely. No, I mean, I think you know, that to make things more crystal, you um you're an exemplar in so many things. Um and one of the things that I appreciate about you as a colleague is that I can learn from you.
Hmm.
And we can have conversations about life. We can have conversations about structuring a practice better. We can have conversations about how would you treat that,
Yeah.
right? um but part of professional growth is also having a vulnerability enough to be able to say, I don't know everything,
Hmm.
and there's someone who may be amazing, who may look like me, who may have more education than me, who may have less, who may have been doing this longer or been doing
Hmm.
this shorter. And I can't be bothered by the
Yeah.
idea that because of the way it's packaged, that it can't help me.
Hmm.
And so, you know, you started this conversation around the idea of how do we create diverse workforces? How do we keep our passion in medicine?
Hmm.
Um, as you know, we've been through incredible times in medicine. We've been through, living now in a world of a pandemic. We understand much more about the business of medicine, with, you know, challenges in terms of health systems being able to sustain themselves. Like we understand all of the components that are medicine.
Hmm.
Um, and through that, it is no small feat that the groups that survive those challenges the best are the most diverse groups. When I interview folks for jobs, they often ask me, like, well, what's your view on diversity? And, da, 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 da. And I say, just look. Like, I don't have to prove to you that I'm into diversity. Like, look at our faculty,
Yeah.
look at our residents. Like, we live it.
And for a lot of our listeners, I think they won't understand everything
Ah,
that we've gone through. So I'll give
right.
them a quick snippet, right? So we were part of Hahnemann Hospital in Philadelphia, a hospital that has had financial struggles for a long time. Finally, the hospital leadership declared bankruptcy, and a lot of residency programs just scrambled.
Mhm.
What to do? What are we going to do? Um, and the Drexel Family Medicine residency program was the only one that was able to transition to another healthcare system intact. And so for our listeners here that seems at least for me it was a fairy tale. And I actually joked with another colleague and saying, okay, this we have to have some sort of white horse come in and save the day. But honestly, it was us,
It
right?
was us.
It was, our diverse faculty and diverse in position,
Mhm.
in culture, in
Yep.
race. I mean, we all banded together
Mhm.
and we were able to write a new program. What did it take,
Yeah,
Leon?
listen,
How many
listen,
days?
listen. What normally would take 3 to 6 months, we handled in 4 days.
Yeah.
And so, that those will be the times, but those are about unifying around mission. It's
Mhm.
about understanding what we stand for, and it's about the fact that because we had diverse talent, we had numbers of individuals that brought different things to the table that, when put
Absolutely.
together, made us more successful.
And
It made
commitment. I mean, it was just
Yes.
that commitment to the community too,
Yeah, absolutely. No,
you
no,
know?
that is unending with us. I mean, it
Mhm.
was the idea that we need to make sure that we are contributing in a steadfast way to our population. We were committed to our educational mission, and we're committed to each other,
Mhm.
right? Like
Yeah.
I wanted you to stay my colleague.
Yeah.
Like, that matters to me. Like, I like being able to just like send a quick text message or see you on a Zoom or see you in a
Mhm.
meeting, like, or pop over to your office and like we can have some insomnia cookies, something to that effect, right? We
Yes.
can just have a good time. Um,
So
and
for
yeah.
systems, for health systems that really want this, because I feel
Hmm.
like a lot of health systems, they they want to have a diverse workforce. They want to recruit individuals that will help
Hmm.
solve big problems. They just don't know how.
Yep.
How? So what investments do we have to make in our system to allow this to be possible?
Um, so many. So first, we have to embrace that this is a question that can ultimately never be perfectly answered. It's
Mhm.
like, how do you get enough diversity? You never have enough, right? Like, you're always continuing to work and develop.
Yeah.
We also have to understand that our pool of talented individuals is also incredibly small relative to the need,
Right.
right? Like health systems need more diverse physicians, clinicians, educators, etc., administrators, leaders than are available.
Mhm.
So the first piece has to be working to build our pipeline. So that's the one piece, right? So you mentioned pipeline programs, you mentioned education, you mentioned all those things. That's one piece of the puzzle. The other piece that I think is underutilized is we actually have to invest more significantly in our leaders when they're in there, especially in their early and mid careers,
Yeah.
because we need to reinvest in that educational piece. Because the more investment I put in Janet, the better she is, the more opportunity she creates for others.
Yeah. And
And
it's
so, go
it's so
ahead.
funny you mentioned that because I had the opportunity of getting that in the military.
Mm,
It wasn't leadership was not an extra, it was an expectation.
mhm,
And as such, because it was an expectation, you were assigned a mentor.
mhm,
You were assigned, there was a structure around our new faculty that really primed them up and prepared them for leadership roles. And transitioning to academics, it's there, but you have to find it. It's
mhm,
not a defined structure and it's not an expectation. So when you want a lot of these physicians or clinicians to really step up as leaders, I feel like they just don't know how. They want to, they
mhm.
don't know how.
Right. I think we also have to, and the reason why I talk about leader development is incredibly important is that we need more people in capacities to make decisions.
Right?
So you need them in your C-suite. You need them as training directors. You need them as office managers, because who's going to make the decisions on who we hire?
Right?
Who's going to decide what are the characteristics that we're looking for to make the next great hire? Are there other traits? Does it matter what the GPA was? Does it matter what college you went to? Does it matter the distance traveled?
Hmm.
Who has experience dealing with all those things? Who can see the talent where others don't?
Right?
And that isn't because people who are from historically underrepresented backgrounds are not the most talented. I'm not saying that at all. I'm actually saying oftentimes they're overqualified because
Hmm.
of the amount that they've had to endure
Yeah.
to actually get to where they are. If you get someone of color or someone from an underrepresented group who's making it, trust. They have traveled a journey.
Yeah.
They have understood how to navigate those minefields. They've had many successes and they've also had challenges that they've overcome. One of the things that I often look for so I'm a residency program director, which means I train family medicine doctors. One of the things that I often look for in my applicants is, have you failed and how did you respond?
Right?
Because I actually love it when someone's had a significant challenge and then they've shown me that they can overcome it.
Right?
You
Well,
know,
it shows their character. And I think
absolutely.
in medicine, man, we face things that, at least for me, I didn't know that I was gonna face, you know, um, when I was in attending, having
Mhm,
the a patient death or
mhm.
maybe a wrong diagnosis because we're not perfect. And as
Nope.
much as we try, sometimes we get it wrong.
Yep.
How do you turn around from that? And how do you do that with integrity? How do
Mm,
you do that without, just giving up? How do you look a patient in the face, say, listen, I'm sorry. I thought it was this, but it wasn't,
mhm.
but I'm going to lead you through,
Yep.
and that takes a certain amount of character to be able to do that.
Mhm.
Um, so 100% agree with you,
Yeah.
Leon.
No, I mean it
Uh,
is. Listen, you and I have collaborated on a number of efforts and initiatives, and we've built. And one of the things I think that happens is that um, when you get people who are similar in drive, we don't have to actually drive the car the same way, but if we
yeah,
have a motor,
yeah,
you can definitely pull in the right direction. And so when we talk about, again, how do you create that diverse workforce? Pipeline, leadership training,
yeah,
um, creating inclusive environments. So how do you do that? So yes, it's leadership training. It's also challenging people in those spaces to actually learn and undo some of the things that they've historically done. It's teaching people about, so how do you decrease the cloak of that privilege?
Mm-hmm.
How do you share your pulpit? How
Yeah.
do you share that space? How do you decide, like, I don't actually need to lead on this project?
Mm-hmm.
I do need to say, you know what? The person sitting next to me needs an opportunity,
Mm-hmm.
because it is not just mentorship and advising, it is sponsorship.
Yep.
It is who is talking and saying phenomenal things about you. But I also believe this: we are also responsible for our own destinies. I never want to absolve personal accountability and responsibility as a
Mm-hmm.
part of it. And we live in a world now where we are all challenged with balancing things like wellness, work-life balance, accountability, fatigue, exhaustion, work too much, not enough,
Mm-hmm.
work integrator, work segmenter. There's all these fancy words around how do you find the perfect balance.
Mm-hmm.
Each person has to decide for themselves what it is that is a good work-life balance. I have it. Most people would see my life and think I am completely on tilt. And yet I love what I do.
Mm-hmm.
I wouldn't be happier doing other things. And all the people in my life that know me and understand me and that I love also understand that this is who I am.
Mm-hmm.
And so if I'm working on a Monday night and other people are watching TV, or I'm hanging out and doing something on a Sunday afternoon related to work, but then I stop and I play cards with the kids, and then we whatever, and we're watching something on Marvel and Disney Channel. Like I flip it and I bounce it. But
Yeah.
I love that engagement, but I'm not scared of the grind and the hard work, because the other part of it is that the other part of being able to survive and thrive in this is balancing that hard work and being ready when the opportunities present themselves. Other thing that just comes to my mind, and I was just giving a talk the other night, and I tell people this all the time: you need to be as selective with your no's as you are with your yeses.
Mm.
Be careful about what it is that you not only say yes to, but also be careful about what it is you decide to turn away. Because sometimes the one thing, that one session where someone invites you to a meeting, the meeting may not be the thing, but it may be the person you sit next to at that meeting,
Yeah.
who is the person that you just happen to share a conversation with, who becomes the door to your next professional opportunity. That would not have happened if you just didn't carve out 30 minutes of your time
Mm-hmm.
to take advantage of a new opportunity. And
And
so when I talk about that push, that's it. I'm sorry, go ahead.
no, I was going to say, and for a lot of our students, that at least for me, coming from a
Mhm.
different culture, different background, I know for me, it is even now sometimes uncomfortable to go to, a meeting or maybe a dinner event and I really have to push myself.
Mhm.
But I 100%, I've gone, on or even having conversations with people that you wouldn't typically, and I have had opportunities come from that I would have never. Right now I'm kind of helping oversee these COVID operations for our university, and my right hand that really helps me, it was an opportunity. It was just casual conversation that, we were both went to an event that I wasn't actually going to go to initially, and I had to push myself. So agree, like, sometimes we find opportunities in these social events outside of work too.
Yeah, no, absolutely. I just, I am amazed that we are each put in positions now where we can not only continue to develop phenomenal careers, but actually impact opportunities for others. And so the other part of this is like, why keep doing this?
Hmm.
So the first thing I think to myself is, well, what else would I be doing? Right? Like, yes, are
I'd be a
there other
terrible
things?
cook. Yes, I agree.
Right. No, listen, but so my thought is that, like if I wasn't a physician, I would be teaching something. But I
Hmm.
teach medicine every day and I love it. I love teaching my patients. I love doing those things. Um, Nothing gives me more joy than the interaction with, whether it's a resident trainee, a medical student, and helping them reach whatever that goal is. Sometimes it's passing a test. Sometimes it's understanding a medical diagnosis. Sometimes it's dealing with something in their personal life. Like my job, I'm here right now to help people as a part in their journey because there have been people who helped me in mine. And so it will be disingenuous for me to extract myself when I know I have possess a skill set that can actually allow others to fulfill what it is that they have. And so that really is what like fuels me. And then the other piece is like, if I wasn't doing what I was doing, I wouldn't have met you.
Fair.
I remember interviewing you for your job. I mean, like, let's bring it back. I remember you sitting in that little office I used to have with not a real window, but a little piece of glass. And we were having a phenomenal conversation. I was like, I need to work with her. Like, I don't know what's going to happen. I don't know if we can figure out all the details, but what I've figured out is that I want as much talent in the room as I can get.
Yeah.
You give me all the talent, I'll figure it out. Because what I don't want is people who don't have skills.
Right.
I want people who want to work, who have defined skill sets. And let's like figure out all these challenges together. And one of them is how do we create environments where our other colleagues want to stay and do this work?
Yeah.
And so part of that is that how do we help each other find those components of the job that feed us?
Mm-hmm.
Like you have to find something in your daily walk that actually feeds you.
Yeah. And for our listeners here, for me, medicine is about relationships.
Mhm.
The reason I stay, right, is that relationship with my colleagues, relationship with my patients. So again, this kind of brings it, full circle. You're listening to, Leon and myself talk about why we stay in medicine. I want you to explore why you stay in medicine. How can we help each other stay in a field that is very difficult right now? Being a physician is difficult. It has its challenges. The work hours are what they are. But then the rewards, at least for me, coming home at the end of the day and having a student that got it, they're had done their first pelvic exam and super excited, or I know. For me, that is why I continue to stay in medicine, right? And why I encourage others to, just like you, Leon, to try to figure out what motivates them. How can we make it better? How can we make this system better? So with that, thank you, Leon. Thank you so much for joining us tonight. If you would like to know more about Dr. Leon McCrea or Stay in Medicine, please visit stayinmedicine.com or check us out whenever possible with our podcast. Let's keep these conversations going. Thank you, everyone.